ADHD medication, biochemistry, professional use, and risks. Introduction. Professional athletes and some amateurs use these drugs to increase focus, suppress appetite, enhance training intensity, and in some cases combat mental fatigue during dieting or contest prep. But behind the quick burst of energy lies complex biochemical processes and significant risks. 2. Biochemical processes. 2.1. Dopamine transporters, DAT. ADHD medications block dopamine transporters in the brain. This increases dopamine levels in the synaptic cleft, leading to improved motivation, focus, and reaction speed. In bodybuilding, higher dopamine equals better mind-muscle connection, greater training discipline, and sometimes increased aggression in the gym. 2.2. D1 and D2 receptors. D1 receptors are linked to the reward system and motor precision. D2 receptors are more associated with motivation and endurance. Long-term stimulant use can downregulate these receptors, leading to a risk of dopamine deficiency, depression, and motivational issues after discontinuation. 2.3. The HPA axis, hypothalamus-pituitary-adrenal axis. ADHD medications increase cortisol release via the HPA axis. Cortisol is catabolic, or breaks down muscle, but in short bursts it can boost energy and reaction time. In bodybuilding, cortisol levels may be balanced since anabolic steroids have anti-cortisol effects. 4. Why professionals combine ADHD medication with steroid cycles. Diet phase. ADHD meds suppress appetite, so easier to maintain a caloric deficit. Contest prep. Sharpen focus during long, exhausting training and posing sessions. High-intensity training sessions. Increased alertness and faster reaction times. Mental discipline. Reduced risk of cheat meals in the final weeks before competition. 5. Dosage and timing in bodybuilding. Not recommended. This is a description of reported usage. Methylphenidate, 10 to 40 milligrams a day, often split before training and in the afternoon. Lisdexaphantamine, Vyvanse or Elvanse, 30 to 70 milligrams in the morning for long-lasting effect. Adderall, 10 to 30 milligrams before training for maximum performance boost. Timing. Most common is 30 to 60 minutes before workouts or during diet phases. 6. Scientific studies and statistics. Research shows stimulants can increase VO2 max and endurance in some sports, but evidence for direct muscle strength gains is weak. A study, Advances in Nutrition 2021, found that dopamine-enhancing drugs can extend time to exhaustion by up to 15 to 20%. Data from fitness forums and doping studies suggest that 5 to 8% of competitive bodybuilders have used stimulants like ADHD medication in connection with competitions. 7. Risks and side effects. Cardiovascular, elevated blood pressure, heart palpitations, arrhythmias. Mental health, anxiety, insomnia, depression upon withdrawal. Hormonal, possible impact on testosterone production with long-term use. Addiction potential. High risk of dependence due to dopamine surges. Muscle catabolism. High cortisol levels can break down muscle unless countered by anabolic agents. 8. Solutions and safer alternatives. Natural dopamine boosters, tyrosine, caffeine, and green tea. Periodization. Limit use to short cycles, max 4 to 6 weeks. Medical monitoring, ECG and blood pressure checks. Mental support, psychologist or coach to prevent dependency. Conclusion. ADHD medications are powerful tools, but also potentially dangerous. In bodybuilding, they're not used to directly build muscle, but to sharpen focus, suppress appetite, and elevate performance during critical phases. However, the biochemical cost is high. The dopamine system, the heart, and hormonal balance can all be severely affected. Professional athletes sometimes combine them with anabolics to offset certain side effects, but this still involves major health risks.